I'm here to talk about the Blood Sugar Basics program, which is a program sponsored by American College of Endocrinology and with support from Merck. And this program is designed to help people with diabetes to reach their A1C goal and their blood pressure goal and cholesterol goal and live healthier because we know diabetes is a very complex disease and at times can be overwhelming. I am an endocrinologist myself and take care of patients with diabetes, and I know how difficult it is, especially at the beginning when the diagnosis is made. The goal of this program is to really break down this complex disease to smaller steps for patients to understand what is the condition that they're dealing with, what are some of their goals, and communicate with their physicians and come up with a plan to reach those goals. And then from time to time they have to regroup because diabetes is a progressive disease and change the treatment. The steps that are very important in management of diabetes, obviously, is first education. Understanding what your disease is and what you can do about it. It's not your fault that you have diabetes, but the good news is that you can do something about it to prevent the devastating complications of diabetes that we are all worried about. And so the steps, lifestyle modification is the first step. Eating correctly, getting involved in physical activity, understanding what your goals are. American College of Endocrinology suggests A1C goal of less than 6.5 for majority of patients. So what is A1C? A1C is the average of the blood sugar over the past 3 months. So it's a batting average of the patient's control. This 6.5 that I talked about is not for everybody. It really needs to be individualized, and it's a discussion between patients and their physician to look at the comorbid condition, other problems that they may have. It may be higher, it may be lower. The other aspect of diabetes management is really the ABCs of diabetes, as we talked about. A is for A1C, B for blood pressure. Again, monitoring blood pressure, taking your medication as prescribed. Cholesterol, same thing, knowing what goals are. So generally speaking, the first step is understanding what you need to do, and then creating a roadmap with your physician how to get there. But because diabetes is a progressive disease, from time to time we have to reevaluate and decide, okay, this is working. If it's not working, why, and what can we do about it? Oh, it's a whole new world for them. First of all, diabetes many times has no symptoms. Although typically we think that, if you're going to the bathroom a lot, excessive thirst, excessive urination, feeling tired, those are typical symptoms of high blood sugar. But many times patients don't have any symptoms. So this website also encourages individuals who are at high risk of diabetes to be checked and be screened. So many times diabetes is diagnosed by just doing a simple blood test, and then it's, wow, I have diabetes. And actually I've seen that many times when patients who knew that they're not eating right and maybe they're not active enough, as soon as this diagnosis is made, it's like they see the light and they become motivated to do the right thing and control it, nip it in the bud very quickly. And this website, again, helps them with the material and the tools that we have, to help them really not only become knowledgeable about what diabetes is, but also what to do to control it and prevent, hopefully, delay or prevent complications of diabetes.